Hello, everyone. My name is Dr. James Ford, and I'm giving this presentation on behalf of myself and my colleagues at UC Davis Health. Today, I'm going to talk to you about systematic screening for chronic hepatitis C virus between ambulatory and emergency department settings. Our ED and clinic-based HCV testing programs were supported by grants from Gilead Sciences. Apart from this funding, the authors have no other disclosures. Hepatitis C is responsible for 2 million chronic infections in the United States, making it the most common bloodborne infection in the country, with dangerous downstream clinical consequences such as cirrhosis and hepatocellular carcinoma. In 2020, the United States Preventative Services Task Force recommended universal hepatitis C screening for all adults aged 18 to 79 to prevent these downstream complications. While screening for infectious diseases is typically thought of as a primary care service, we believe the ED is a unique environment to screen individuals who do not otherwise have access to other forms of healthcare. In this study, we aim to compare the use of a targeted population screening protocol in the ambulatory setting to a universal screening protocol in the emergency department setting. We conducted a retrospective 6-month cohort study at a single tertiary academic health system where our two settings were the emergency department and a primary care clinic. Our population in the ED were all adults over the age of 18 with no previous hepatitis C viral load on record. And in the clinic, our study population was individuals born between 1945 and 1965. Our primary outcome was hepatitis C virus antibody seroprevalence between cohorts, and our data analysis plan consisted of using simple descriptive statistics and comparisons between subgroups were performed using logistic regression or linear regression for our qualitative and quantitative variables, respectively. This is a table going over basic patient characteristics stratified by screening setting. We see that the total number of patients screened in the ED was 6,745 and in the clinic 507. Patients in the clinic were older at 64 years compared to 47 years compared to the emergency department. The gender distribution or the sex distribution was roughly similar between study cohorts. And it's important to note that only 17% of our patients in the ED endorsed having a PCP. This is a table of our screening results stratified by screening modality. We see that for the HCV antibody seroprevalence, it's a lot higher in the emergency department at 8% compared to just 0.6% in the clinic. And the same trend continued for the viral load seroprevalence at 3% compared to 0.2%. We found that for patients in the ED that were antibody positive, they were mostly white and male. And for the patients that were positive in the clinic, there were 2 patients that were female and all patients were white. So in conclusion, the HCV antibody seroprevalence was much higher in the emergency department than in the ambulatory setting. And the emergency department screening increased the catchment of younger men who did not have PCPs relative to the ambulatory setting. And it's important to note that the type of, so in the clinic, most of our patients are Medicare patients or patients with private insurance. And in the ED setting, most of our patients have public insurance or Medicaid or no insurance at all. And lastly, we believe that universal screening in the ED is an important way to screen patients who do not otherwise have access to care. Here's a list of our references, and thank you for tuning in.